So we're talking now to Tara Regan, who is the Communications and Advocacy Manager at Arthritis Ireland. You're very welcome to the show, Tara.
Thank you very much. Delighted to be here, John.
You might talk to us a bit about arthritis, what it is and how it affects a person.
Yes, of course I will. So I suppose I'll start off with just mentioning that there's over 100 different types of arthritis. It's a very, very common condition. A lot of people don't realise that there's so many different types of arthritis, and there are over 1 million people in Ireland living with the condition, which is about 1 in 5. It could be as high as 1 in 4 people. And I think we all know somebody in our lives, in our families, who lives with the condition. So, John, you're putting your hand up there. So
I am,
I'm
of course.
one of those people. And yeah, I mean, obviously, then you'll have an understanding of the difficulties that can come with living with an invisible condition for a lot of people. And I suppose as an organisation, we are the National Patient Organisation, and we work to support people who live with arthritis, to provide them with services and supports to help them improve their health outcomes, but also to live their lives as fully as possible as they can while managing the challenges of arthritis and related conditions.
Is the treatment for arthritis always medication, or are there others?
So that's a really good question, John. I'm absolutely delighted you asked that question.
Thank
because medication is just one component of managing arthritis. There are many other ways in which people can manage arthritis and can improve the quality of their life and improve their health outcomes. And actually, next week is National Arthritis Week, so 31st of March to the 6th of April. And the theme for this year's National Arthritis Week is lifestyle medicine. And lifestyle medicine is an approach to managing a chronic condition and your lifestyle, whether even if you don't live with a chronic condition. And it's about making small steps to improve the quality of your life and your health outcomes by making very small changes in your daily life. So there are 6 pillars to lifestyle medicine. So the 6 pillars are diet and nutrition, exercise and movement, sleep management, stress management, substance misuse, and also, did I mention stress management?
No, that's the last one.
Yeah, that's the 6th one. So all of these components, which all are connected, because there's a connection between all of those 6 pillars, by incorporating small changes to your life while managing those 6 pillars, you can improve your outcomes with arthritis. And I suppose many of your listeners will know that one form of arthritis, osteoarthritis, which is one of the most common forms of arthritis in Ireland, it's a non-inflammatory arthritis, and it is not managed through medication. Now, there's a lot more research going on in that space at the moment around the treatment of osteoarthritis, but that is one of the most, lifestyle medicine has a really important role to play in managing osteoarthritis. Medication has a bigger role to play in inflammatory arthritis, such as rheumatoid arthritis, psoriatic arthritis, axSpA, but still lifestyle medicine has a role. So in all of no matter what type of arthritis you have or musculoskeletal condition you have, lifestyle medicine and self-management, which is the management of your condition and learning how to develop the tools and techniques to manage, flares, stress, sleep, are really, really important in making sure that your health outcomes are managed well, and also to prevent the onset of further conditions. So you may live with arthritis, but because you live with arthritis, you have a greater risk of developing further conditions. So it's really, really important to manage your health and well-being on an ongoing basis, and to just see medication as one component of that.
There was a general belief up to recent times, wasn't there, that arthritis was an old person's, an inevitable result of getting older. Obviously, that's not true.
Definitely not, Patrick. And in fact, there are many children, there's about 1,200 children and young people in Ireland living with arthritis. And that can be something that you're diagnosed with from as a baby right up to your teens, and can continue on into adulthood. So it's really important to recognise that it's not just a disease that affects older people. It affects a lot of younger people, people in their teens, people in their 20s and 30s, people who are raising families and having children, managing their work and their careers and their studies in school and in college. And it can be really, really challenging for people when they're trying to juggle many things in their life, and they may get a diagnosis, and it may really, really lead to, a lot of, appointments for them, scheduling meetings with healthcare professionals. So a lot of the work we do as well is around preparing people for managing, your appointments, making sure that you're on top of how to discuss your treatment plan with your healthcare professional, and making sure that you're a partner in your treatment plan, so that you're really, really engaged with healthcare professionals and that you're working with them to make sure that your health outcomes are managed as optimally as possible.
And exercise is a massive part of it.
Absolutely. Exercise is so important. And on that, I mean, one of the things that we're very careful about is to mention that movement is really important as well. So exercise can sometimes be off-putting for people, and especially if you're living with pain on a daily basis. You might wake up in the morning and you might have had a bad night's sleep. You might feel like exercise is the absolute last thing that you can do today. So what we try to say is that movement is medicine. So if you can manage some small exercise movement in your day, which could be a very gentle walk, it could be not uphill, it could be completely on a flat surface. If you can manage some stretching in the morning or later in the day, if you're very stiff in the morning, if you can manage to go to your swimming pool and engage in an aqua fit class, or even walk up and down your pool, because it might be helpful for your joints not to be on a hard surface and it would take the weight off the joints. That can be really, really helpful for you as well. There's lots of different ways you can incorporate movement into your day. It doesn't have to be an exercise class. It doesn't have to be joining a gym. It doesn't have to be pounding the pavement. But we would say movement is really, really important if you can. There's some days you won't feel like you're able to do it, and that's absolutely fine. But there used to be a thinking with arthritis that rest was best, but that's not necessarily the case. Obviously, if you're experiencing a very significant flare, you can tone it down. You can take it down to a level that's, manageable for you. But really and truly trying to move regularly is really, really important, to manage the stiffness and the pain and the inflammation that you may experience.
And the booklets on your website, they're a brilliant idea. They're full of information. Where did that come from?
So we have a health information officer, Maeve Coyle, who writes our booklets, and she also writes our blog, which is produced every second week. So if anyone's interested, they can register on our site for that. The booklets are all available to download, and we have condition-specific booklets. So for example, you might have rheumatoid arthritis, and our rheumatoid arthritis booklet would be really important for people to read. It's a very extensive booklet. So it's one of those ones where you probably go back to it time and time again. And then we have other booklets that are more general and about things like, for example, drug treatments and arthritis. So that would be a really important one to read through, to understand the different types of medication that are available for different forms of arthritis and that are recommended. And they're broken down into different categories, and we've tried to make that as reader friendly as possible, and to make sure that it's understandable, because it can cause quite a lot of confusion for people. And then we have a lovely booklet that was written by a group of health professionals, and we contributed to it, and it's called Living Your Best Life with Arthritis. And that's all about lifestyle medicine and how the 6 pillars of lifestyle medicine can be adopted by anybody, regardless of their health status, and is really helpful in terms of setting goals, writing down a plan, and making changes to your life, habit stacking, incorporating those small positive changes to your daily life that will have a really significant impact on your long-term health.
Tell us a bit about what advice would you give to somebody newly diagnosed?
So somebody who's newly diagnosed is probably dealing with a lot of different emotions. So, for example, if you've been diagnosed with arthritis, you may not know a lot about arthritis. So the first thing we would say is that, you need to empower yourself with knowledge. So go to trustworthy sites and booklets and information and sources of information to get an understanding of what you're dealing with. Like I said, there's a lot of different types of arthritis, so it's really important to know which type you're dealing with. Your healthcare professional, it may be a GP, it may be a rheumatologist. If it's inflammatory arthritis, will give you an indication of what type of arthritis you're dealing with, and hopefully develop a treatment plan with you. Once you know what you're dealing with, then I would recommend that you visit our website And our website will have information about the different forms of arthritis. And then when you know a little bit more about it, it might be a good idea to park it for a little while, talk to family and friends, explain to them what you're dealing with. That's really important. It's really important that your network of support understands what you're going through. And that can be really, really challenging because a lot of people don't understand what pain and inflammation and stiffness and immobility can do to people. Not just physically, but mentally. It can really take a toll mentally on people as well. The next step then I would say to you is to have a look at the courses section of Arthritis Ireland's website. And we have a number of self-management programs that are available to people to take part in. But what I would say to you is that we have a helpline, and that helpline is manned by volunteers who understand what it is like to live with a condition like arthritis. It's open Monday to Friday, 10 to 4 p.m. and the number is 0818 252 846. Talk to someone on our helpline. They will point you in the direction of the correct self-management program and the services and supports that we can give you and other organisations if it needed. So if you talk to somebody on our helpline, it's not a case of, I'm really desperate and I need to ring the helpline. It's a support line that is manned by people who understand you. It doesn't matter how insignificant you think your issue is. It doesn't matter if you want to talk about medication, your emotions, what kind of exercise you want to undertake. If you have a question about your condition, they will do their very best to support you. And if they don't know what the answer is, they will find out and get back to you. And they'll also point you in the direction of our STEPS program, which is basically a tailored program that we provide to people so that they can empower themselves to manage their condition effectively. So it's self-management on a tailored level, and they'll do a call back to you in a few weeks to check in with you to see how you're getting on. You'll get a personalised pack of information from Arthritis Ireland. And then when you're ready, you might consider signing up to one of our self-management programs, which are really helpful in terms of getting a really good understanding of how to manage your condition. And our main program that people start with is called Living Well with Arthritis and Related Conditions. It's a 6-week program, and you can take part online or in person. We have them at various different locations throughout the country. And then you will be in a group of people. It's a limited group where you will meet once a week for 6 weeks for 2.5 hours. And you will discuss things such as healthy eating, exercise, how to manage your medication, how to deal with health professionals and manage your relationship with them, and how to become an active partner in the management of your condition. And that 6-week course gives you a plan for moving forward with your arthritis, but it also gives you a support network, and you will meet people in a similar situation to you. And we often find that people who can partake in this course go on to develop networks with these people that are supportive as they go on. The people who deliver the course are also people who live with arthritis, and they are volunteers. So it's a really important step in managing your condition. So that's where I would send people. And then obviously our website has a massive amount of information. And sometimes that can be overwhelming. But what I would say to you is take your time, dip in and out. We have a newsletter that's delivered once a month. We have a blog that comes out every fortnight. We have a vast amount of webinars and interview recordings with clinicians and doctors and dietitians and specialists of all kinds, physiotherapists on our website, and you can take your time and go through those. They're really detailed and they're very helpful. We also have a podcast series, which is it's all about, anything to do with arthritis and related conditions. Like, for example, we've just launched series 4, and at the moment we have an episode that was released today, and it's about that was last week, was future-proofing your home. So how you might consider adapting your home as we age to make sure you're able to live independently and healthily in your home as we go through different stages in our life. The one today that's being released is about foot health and arthritis. So how to manage foot health when you live with arthritis, and look at how to manage the health of their feet. Should actually listen to this podcast because it's such an interesting one. It's about it's led by an MSK physiotherapist and a podiatrist, and it's really, really helpful in forms of telling people how to do daily checks on their feet, the type of footwear they can choose, information about orthotics. And a lot of people who don't live with arthritis may have questions about their feet and foot health. And this is a really, really helpful podcast for that. So our podcast series is also a great source of information. And then, as you mentioned, our booklets are really fantastic as well. And we have a lot of activities taking part in our community. So you can look at the in your area section of our website to see if there's a network of people there that you might want to meet with and go for coffee with, or take part in, there's Tai Chi classes, there's aqua aerobics classes, there's walking groups. So there's a lot of content there and a lot of activity, but you can take your time and go through that, decide what's important to you at that particular time, but please reach out to us and don't be afraid to ring our helpline for any question that you might have.
You just answered about 10 of my questions, so.
Sorry, I've already talked for too long.
Don't worry about that. I can definitely recommend your website. If I was newly diagnosed, I'd use that as my first point of contact, because it has a huge amount of information. And as you said, you can dip in and out of it. And the second thing I'd say is that meeting somebody with the lived experience of arthritis, I would say that's huge in forming your own plan.
Absolutely, yeah. It's great to have a support network with somebody who understands what you're going through. It's very difficult to beat that interaction with somebody who can really empathize with you and understand where you're at, and that you may be having a really difficult day today. Things may get better in a few weeks' time, but it can be really helpful because, like I said, it can be somewhat invisible, and sometimes people, family and friends don't necessarily understand the limitations, the pain, the stiffness, and then the lack of sleep can really, lead into, like, it can make you just every day a little bit more difficult, and that can affect things like diet and your ability to exercise, and all of those kind of things are really important to manage, and it's really important to talk to people if you can about that.
Very important. What about some of the entitlements for people with arthritis?
Yeah, so we actually, last year we had another podcast episode which was all about navigating that space and entitlements and benefits. I would really recommend that people spend some time listening to that podcast, and we also have an entitlements and benefits section on our site. That's always a space that changes regularly, so do keep an eye on things. There's lots of different options there for people depending on your circumstances. It's quite a complex area, and it can be, and that's why we did a podcast last year on that specifically, to give people some guidance and to break it down, because it can be quite confusing for people. So I would say take your time with that and get the support of somebody if you need it. Citizens Information can give a lot of information as well to you and support if you have questions.
What kind of areas of research do you get involved in?
Well, just last year, we did a big research piece called Counting the Cost of Arthritis. And that was a piece of research that we did with the RCSI School of Population Health. And that research was to understand the personal financial cost of living with arthritis. So that was around talking about things like, for example, how much people are paying for prescriptions, how much they pay when they go to visit their GP or their clinician, and things also around like the time, the cost in terms of people's time traveling to and from appointments, waiting times, distance from health professionals. It was a really fascinating study, and actually we have a webinar on it on our site and a full booklet that you can download and read through each of the different sections. And it's a really important read, because what it really does do is highlight the inequity for people who live with a long-term condition such as arthritis. So it can be really stark for people, especially when it comes to issues such as, maybe not being able to work full-time, having to work part-time, or not being able to work in the way that they want to do, or not being able to take a promotion at work, for example, because they may not be able to take on the extra work. So there's a lot of inequality there for people, and this report really highlights that. It really lays bare the stark reality for somebody living with a chronic condition, and the reliance that they sometimes have on family members and friends and neighbours to assist them if they're struggling. So I would really recommend it. It's called Counting the Cost of Arthritis, and that's our research piece that we did last year, and very, very interesting, and very, very much broken down in a user-friendly way so that people can read through it and all of the important information has been pulled out for people to see.
I read through it completely and didn't find it difficult at all to use.
Yeah.
And it's very comprehensive. So
Great.
I'm going to talk a bit now about Arthritis Ireland. When did that come on stream?
Well, I was fortunate enough actually to be involved in our 40th anniversary celebration back in 2022. And it was actually a year late because because of COVID.
Yeah.
We had to delay it. So the organization is over 40 years old. And the organization has really gone through, I suppose, decades of changes in terms of the treatment and the understanding of arthritis. So, for example, around 20 years ago, 24, 25 years ago, there were huge advancements in the treatment of inflammatory arthritis in particular, so such as rheumatoid arthritis, psoriatic, and axSpA. And that has really changed the landscape for people who live with arthritis. We're hoping that there'll be much more advancement in the coming years in terms of osteoarthritis. And there's a lot of research going on in that space at the moment. But really, the world for people living with arthritis has completely changed in the last number of years, and for the better. There was a time when the medications weren't available. We are really fortunate to have access to fantastic treatments in this country, and we're able to provide people with much better treatment and medication. And I think there's a much greater understanding of the condition. And obviously that's one of our objectives and missions, is to make sure that people know that we are the go-to organization for services and supports, but also that there is help out there, there is support out there, and there are treatments available, and there are things that you can do. And I would say that a lot of the thinking around treatment has changed in recent years. So it's a two-way relationship between health professionals and people living with arthritis. It's no longer a case where somebody expects to go to see their health professional and is almost, told what they need to do. It's a two-way conversation about what that person's goals and what's important to them in their life. Is it that they want to be able to work 5 days a week, or is it that they want to be able to care for their children and lift their children up and play with them? Is it that they want to be able to go to an aqua aerobics class twice a week? There's people have different goals in their treatment plan, and it's really important to recognize that we all have different objectives and goals in the treatment of arthritis.
Do you have many members?
So we have a lot of members in our organization, and we're really, really active in that space in terms of having people who are in touch with us regularly. We've over 13,000 subscribers to our newsletters and blogs. We've a huge amount we've over 45,000 people who subscribe to our social media channels. So we're really, really fortunate that we've a great network of people. Of course, we'd love to have more. So if anyone's interested in being, taking part in anything, or even just attending a webinar, or getting involved in any of our fundraising activities, we have a fundraising team who'll be delighted to look after you and help you if you have any ideas. The VHI Mini Marathon is coming up very soon, and we would love to have some people register and support Arthritis Ireland for that. And we're really pushing that at the moment, because obviously we need support financially from people to continue to do the work that we do. And also, I suppose we have, we have a lot of services and supports that we offer to people. So if you're interested in taking part in anything or taking part in a self-management program, you can ring our helpline as well, and they'll be happy to give you information about that.
Is there cost associated with any of your programs or anything on your website?
So for our physical activity programs, there's a very small cost of €6 per class for a 6-week pack. So that's like €36. So we don't have a cost for our Living Well with Arthritis program, which is our flagship program really, and the program that we recommend people start with. And then to attend our webinars, there's absolutely no cost. There's no cost to read our booklets or to listen to our podcast or anything like that. All of the content on our site is absolutely free for anybody to use, and it's completely accessible for anybody as well. Brilliant. So for example,
go on.
Sorry. No, I was going to say for our podcasts, some people might prefer to read a transcript, and the transcript is always available on the site as well.
Brilliant. Well, look, we're just about to finish the interview. Is there anything else you'd like to put out there before we go? No, just I would encourage people to register for our webinars next week if they're interested in attending.
Other than that, I would encourage you to visit our site, which is arthritisireland.ie. And if you have any questions at all about your condition, if you're newly diagnosed, or if you are concerned about your condition, ring our helpline. The number is 0818 252 846, and it's open from Monday to Friday, 10 to 4 p.m.
Last thing, just if you would repeat the website address and the hotline number.
Absolutely. So it's arthritisireland.ie, and the helpline number is 0818 252 846.
Tara, thank you a million for coming on the show. You're very good.
Not at all. It was a pleasure to meet you all, John, Patrick, and Adam, and I wish you all a lovely day, and thanks for having me.
Thanks a million.
Thank you.